Welcome to my YouTube channel, Medical Comrades. So today we are going to study about it is an OBG topic in midwifery called as types of pelvis. This is a question mainly asked in exams in GNM and BSc nursing students. So let's dig into the topic. Once again, welcome. So let us study today about types of pelvis. There are mainly four types: gynecoid pelvis, android pelvis, anthropoid pelvis, and platypelloid pelvis. Here you can see in first slide only, in first introduction only you can see. It is heart shape, it is a oval shape, it is kidney shape. We will study this in next slide in detail. Before that, we go about some funny. This is a comrade trying to be funny. What did the left hip bone say to the right hip bone? Don't worry, we are joined at the acetabulum. What did the left hip bone say to the right hip bone? Don't worry, we are joined at the acetabulum. It is a junction if you know the pelvis anatomy correctly. So there are four types of pelvis in our OBG. First is gynecoid pelvis, second is android pelvis, third is anthropoid pelvis, and fourth is platypelloid pelvis. Gynecoid pelvis is mainly a female pelvis and android pelvis is male pelvis, and these two are abnormal pelvis. Abnormal pelvis. So see the structure. It is made up of two innominate bones, one sacrum and one coccyx. We will see in picture that you can know in detail and in easy way. There are joints. First is sacroiliac joint. Two, joint between innominate bone and sacrum is called as sacroiliac joint, and sacrococcygeal joint. It is a joint between sacrum and coccyx, and symphysis pubis, joint between both pubis. Here you can see the joints. Ilium, ilium, and it is sacrum, joint between these two. Here you can see the joints. These are the sacroiliac joint, and this is the sacrococcygeal joint, and it is sacroiliac joint. Here you can see clear. It is coccyx, it is sacrum, it is true pelvis, which is also called, it is the true pelvis, and it is the false pelvis outside. Anatomical division in OBG, one is false pelvis and one is true pelvis. False pelvis is a part of above the brim of pelvis, as I have showed above pelvis. Here, this is the false pelvis outside, which you can see outside. It is the false pelvis. Forms wise by iliac portions, as you can see there, of innominate bones. Function is to only support the enlarged uterus during pregnancy. It has no role in birth process. And in true pelvis, it is a part below the brim of pelvis, inside of the pelvis. This part, this inside part, it is the true pelvis, and this is the false pelvis. Anteriorly, it is a shallow. It is shallow, formed by symphysis pubis, which is 4 cm normally, and posteriorly it is deep, formed by sacrum coccyx, which is 11 cm, divided into inlet, cavity, and outlet. It forms birth canal, which has main duty of birth processing or liver. Here you can see it is the false pelvis. Outside part is false pelvis. Whichever you can see, it is false pelvis, and inside it is the true pelvis. And these are all the bony landmarks, which you can see in next slide. Which is this part? You comment down, or I will say it is coccyx, sacrum, false pelvis, ischial spines are these. Ischial spines. So let us study now about these landmarks, which are denoted by 1, 2, 3, 4. These are all the bony landmarks which are important to understand the labor process. Here, upper border of symphysis pubis, pubic crest, pubic turbulence, pectineal line, iliopubic eminence, iliopectinal line, sacroiliac joint, anterior border of sacrum, and sacral promontory. These are different of these denotations. It is only a picture for rough purpose. These are not the correct denotations of these landmarks. Do not confuse it. I will say those perfect and what is one and what is two in some other video, or in I will say these landmarks in a short video, which I will attach it in I section. So diameters, you can draw this in exam. Anterior, posterior, transverse. These are so easy. This part cannot be identified because it is a whole shape, means circle shape. So this is the main features: brim, four pelvis, side walls, ischial spines, sciatic notch, Subpubic angle incidence. If you only write this table also you will get marks. To remember this, here is a mnemonic BFCC. Gynapod pelvis shape is rounded, android heart shape, it is oval long shape, it is a kidney shape, and forepelvis is generous. In android it is narrow, in anthropoid it is narrow, and in platypelloid it is wide. And side walls are straight in this, and convergent, divergent in this, and divergent in this also. Ischial spines are blunt and prominent in android, and both are blunt. Sciatic notch, it is rounded, it is narrow, it is wide, and it is also wide. Subpubic angle is 90° in gynecoloid, less than 90° in android, more than 90° in arthropod, and more than 90° in platypelloid. Incidence it is 50%, android 20%. Incidence means how many women have these types of pelvises. 25% of women have anthropoid and 25% have platypelloid. So that's it. Thank you. If you like my slides and notes, please subscribe my channel. Thank you.